Welcome to the podcast. So, today we have a really good podcast, and Faraday and I are going to address Gainswave and all the facts about Gainswave. So, learn everything what it is, how much it costs, how many treatments, is it painful,
What to expect.
all the things, and who's offering it, and does it work? So we'll start with Gainswave again. If you're Gainswave, maybe not specifically, but low intensity extracorporeal shockwave therapy. So it's an LIESWT, so it's a long word, but that's acoustic shockwave for lots of different medical reasons. But in particular, we're talking about erectile dysfunction today.
And Gainswave just happens to be the technology we use.
Yes,
There are a lot of
protocols,
different machines out there, different protocols out there, and that's probably part of the problem when we talk about standardization of care. And that's one of the things that we'll talk about today too, but we refer to Gainswave a lot because that is the low intensity shockwave treatment that we utilize in our office.
Yes. And so when you look at shockwave therapy for erectile dysfunction, you will see a lot of that low intensity, ES or ESWT. Yeah. So you'll see that. But basically that is acoustic shockwave therapy. And again, like Faraday said, there's different provider groups or protocols, and Gainswave is one we use. And so Gainswave's gaining popularity, but at least if you see Gainswave, that there's standardization to the protocols, and there's lots of providers around the company or around the country using it. So that's important, because if you want to find a provider that is well trained in using a standard protocol, then looking for a Gainswave provider does work. So,
and anytime you have a large organization and a large group of physicians and providers in a network like that, we get all that feedback from all those other providers so that we can standardize care and have results with treatment and a history of patients having positive results with treatment, which is important.
There's always meetings and there's always discussions. And again, I think the key is really less about whether they're using that terminology than whether they're experienced and comprehensive in how they address men's health. And that's the key. Like, we do comprehensively address it. So we're addressing it from the inside out. So we're talking about hormones, and we're talking about optimizing your hormones and testosterone, but also not just acoustic shockwave and regenerative treatments, but also PRP, injections, peptides, IV therapy, all of the things. And so there's some other adjuncts along the way.
Lifestyle changes, all of the things.
Yeah, there's a lot to cover. But so finding a provider or office that you trust that has a lot of experience, but what we're saying is, if you find a Gainswave, at least that is a standard protocol. And while that doesn't determine what machine you're using, it does guide the protocol of the treatment. And so there are different machines that you could use with that. So, but finding a provider you trust, looking at their, credentials. And so it does bring us to an interesting study at the very end that we'll share with you that talks a little bit more about providers around the country providing shockwave therapy for ED. So what is it?
So like Dr. Durr said, it's acoustic shockwave. So it is not an actual shock. It's not painful. You're not going to feel it. The machine is loud. I think that's always kind of a surprise to guys when they're getting the treatment. They don't expect that. But shockwave therapy penetrates down to the skin to help promote healing.
I mean, you're basically telling the tissue it's injured and creating some micro trauma to therefore communicate with that tissue to get improvement and regeneration. So that can be blood vessels, smooth muscle and nerves. And so ultimately we want to increase blood flow into the penis. And so this is one of the many treatments that can regenerate, and that's what we concentrate more on. We are in a different podcast talking about more traditional treatments and comparing those with regenerative treatments. So, but for this, microtrauma, regeneration of tissue, blood vessels and nerves, and again, lots of studies to support Gainswave and benefits of it in the lack of adverse effects from Gainswave, which is key.
This is a non-surgical, non-invasive treatment for regeneration. So anytime we're doing anything regenerative, we can have sustained results, not a take a pill, it lasts 4 hours, have to take another pill,
You're
and it
getting
repetitive.
at the root. We do like to get at the root of the issue. And so, again, I think one of the arguments or pushback from traditional medicine, including urologists, with this is, does it really sustain? Like, do the effects last? And so the issue is, no effects last from traditional treatments. You're talking about traditional treatments such as PD5 inhibitors or the little blue pill, Viagra, Cialis, the newer versions of that. But those don't last. Those are just treating symptoms and trying to improve blood flow, and efficacy does decrease with time.
So if we can treat what's causing that interruption of the blood
Mhm.
flow and have regeneration, then you can have sustained improvements.
Correct. And so, actually, if you look at those studies, a lot of them do tend to limit it to 3 months. I'm not sure if that is just a lack of support for studies that don't include medications, and therefore a lack of, the staff and resources to commit to a trial or study that takes some time. But there are longer benefits in studies, and we've looked at it, a lot of that, just to see, because it goes up to 6 months in many of them, and even meta-analysis. But then you found, an even more
That looks
sustained.
at sustained results after 5 years.
Mm-hmm.
So that is just to show the long-term efficacy.
Yeah.
Would it be nice if we had even longer studies? Of course. But as Dr. Durst pointed out, I think that when you are not dealing with a medication or something that a large
Mm-hmm.
organization is behind with more funding, we don't
Yes.
see that money put behind these studies to see these long-term effects on something that's regenerative.
Again, it comes down to, like, is this it? Do I do the series? Because usually we will do it in series. We call them almost six packs. So we're doing some scoring and more objective scoring. And actually, it's men that are answering the questions. We're just scoring it after they answer. And basically, then we decide how many treatments they're going to need. And so we usually do it in six packs, and it could be one, two, or three, or one, two, or three P shots, because we do it more comprehensively. But that depends on what your score is and what kind of improvement we need to see. But again, when a man asks, if I do six and one, is this all I need? I mean, it's like asking if you need to service your car over and over again. There is no one and done in life. So
There's always
maintenance,
maintenance.
there's always maintenance.
So
So
when Dr. Durr says 6 and 1, she's talking about 6 Gainswaves and one P shot, which we'll talk a little bit more about.
yeah, and it depends on the scoring. So,
Yeah.
like, again, the more improvement we want to see, or the more changes that a man is noticing, then the more Gainswave treatments and P shots initially to get those improvements. But as far as getting sustained results, if you're going to do a maintenance, and that determines on what a man wants, like some of our men like it every month they're doing a maintenance, or every quarter, or
Mhm.
some will just do a Gainswave and a P shot like once a year. So that maintenance depends. But so when we're talking about studies that sustain, all the studies support improvement. 3, 6,
Across the
and
board.
up to 60 months. And even that 60-month or 5 year was 40%. Still, we're very happy with the results. So if you're doing some maintenance in that 5 year period, then yes, we probably have even more sustained results. So I would argue that we don't get any sustained results with traditional treatments and offerings. So I think that that's where we really strive to educate on regenerative procedures,
Of
so that we
course.
know we're getting at the root of it.
So let's talk about prevalence of ED and who
Mm-hmm.
this treatment is for. So according to the study in front of me, which is a little bit older, so I would expect these numbers to be higher, is that 52% of men suffer from some form of ED, with 57% of those men being between the age of 40 and 60.
Yes.
So that is pretty young, you guys. At 40 years old, we're seeing this decline in sexual function. So it is happening a lot earlier than I think we realize or talk about, but getting in front of somebody and having these conversations at 40 is less regeneration than getting in front of somebody and having these conversations at 60, where we have a lot of regeneration to catch up on.
And so, are there any guarantees? I say one. It's a guarantee that it does progress with age. And so it's 100% at 80.
Yes.
So at 80 years of age, it's 100%, according to the studies that we reviewed. And so if it's 50% in between 40 and what, 70?
40 and 60.
40 and 60, it's 100% at 80. So there is a guarantee that it does progress with time. And so maintenance after a treatment, and the younger that you get treatment and the more mild changes, the better the results. And then I think, again, sustained results with maintenance treatments. But it's interesting because
We all need maintenance.
yes, you need maintenance. But all those studies also show that it really gets pretty significant in your 40s. We say 30% of men, even in their 30s, will present complaining of erection changes, or some kind of change. And that could be environmental at this point, and toxins that we're exposed to, because there's a lot of them. But 40% of men at 40, 50, that's kind of what we say in general, but the studies do support something close to that. It might be a little bit less than 40% at 40 and a little bit less at 50, but you're at 60% of ED findings at 60, and again, progressing to almost 100%. Well, actually, it said 100%, and the one study at 80. I think that there's a prevalence there. And are you having those conversations with your doctor? Are they screening for that? And then again, I think
that was another one where the studies show that 80% of men go untreated because either they're uncomfortable with the topic or their doctor is uncomfortable with the topic. So no one's having the conversation. They're not getting screened at annual visits. Men aren't bringing it up because of the embarrassment, or there is, I can't tell you how many times guys have sat in front of me and said, I'm embarrassed sitting here having this conversation with you, because it's awkward, right? But it's only awkward if the person on the other side of the table is being awkward about it. We have these conversations all day long. Sex is a natural part of life. It's a natural part of any relationship. These are conversations that should not be taboo, that we should be having with every single patient. And then there's comorbidities that make it worse, such as cardiovascular disease, obesity, cholesterol, diabetes. All these things can add and contribute to the worsening of erectile dysfunction. So if you have those comorbidities, those should be screens for your provider to be asking, hey, are we noticing any other? We have these issues. Are you noticing any erectile dysfunction as well?
And I think that, again, men will bring it up. We don't have much in the way of treatments. And are they always having it? No, and it is an uncomfortable conversation, but doctors aren't actively pursuing it. But patients are now much more proactive about finding treatments for changes that they're noticing early on. And again, like Faraday said, the comfort level has to be there. They're very comfortable in a very short period of time once we start discussing it, and they've actually wanted to discuss. They're not talking to friends, they're not talking to family. Obviously, whoever's in the room with you, if there is somebody in the room with you, is definitely aware. It's, everyone in the room is aware what we say. And so, just addressing that and no denial, and finding those comfortable places and positions and providers to do that. So that's what we want to offer, is that men can, and women can, come in and just open those conversations and feel very comfortable about it.
Doesn't have to be taboo.
No. I mean, sex, again, and sexual activity, whether it's alone, it's with a partner, doesn't matter what partner, that it connects us all. It's something that's how we came about, is from sex. So it's not going anywhere. And I think that there is some more open conversations probably being had in younger populations now, don't you think? With
over the last couple years,
social media and Instagram, and
I will say that's something that I've noticed over just these last few years, that we're seeing younger guys come in, and younger women. But since we're talking about erectile dysfunction specifically, younger men coming in and saying, hey, I'm starting to notice changes. What can I do to be proactive? So that is a really refreshing thing to see on the medical side of it. Yeah. Because when you guys come in, when you first start seeing changes, there are treatments out there. There are stuff we can do to treat and improve sexual function with less treatments. So one of the questions we get asked a lot is, how many sessions, how many treatments do I need? And that varies significantly. My younger guys that have less their score is a lot higher, right? So we look at shim scoring, which looks at how happy we are with our erections. What are we able to get an erection? Are we able to maintain? Are we happy with and satisfied with what we are able to do? And that is very objective from a male's point of view. So they fill out these questions. The higher the score, the less sexual dysfunction they have. So depending on where you are on that score depends on how many sessions you need. Typically, we're looking at 6 Gainswave treatments or shockwave therapy, or 12, kind of depending on where we are. And then from there, sometimes we're doing another 6 or another 12 or 3, depending on where you are. But you can almost guarantee we're going to be somewhere between 6 and 12 in the beginning.
And I think that's where pricing, because that frequently gets asked. And again, it's a little variable, but Gainswave is a whole provider network and the pricing is set. If you're looking at pricing for Gainswave, just an approximate, like 500 per treatment, just think about that number or in that range. But that's where we kind of encourage that you look for potentially Gainswave or provider, at least somebody that is very, very knowledgeable in the field of sexual wellness and men's health, because at least it's standard when you have a provider that is doing Gainswave or has done Gainswave. And so those prices are pretty set too. And again, how many are needed are dependent upon your scoring. And those are numbers that you ask. And so I think that's why primary care and maybe even urology do not address it, because it's not a vital sign you're doing. And so it has to be an intake form. And so you fill out a lot of those privacy HIPAA forms, medical, but I have not yet seen, even on the gynecology intake, anything about sex yet. And so I don't know that we're there. And so traditional treatments, if you think about urology, so erection changes with time in men are inevitable, like we talked about. And a lot of them go without treatment. So if those conversations are being had, what are they offering you as far as treatments? And usually it starts with the little blue pill.
Yes.
And we've had videos before. You need to be told and you need to have conversations about how to take that. And then injections as it progresses, where you're doing injections prior to sex. And again, we'll do another episode on prostate cancer and ED, because that needs to be a conversation that is much
it's
more
very prevalent after.
Very prevalent. So, and we'll talk more specific about that. And then obviously, penile implants but let us know where you guys have been with changes in how your doctor has addressed that. Because we would love to know, little blue pills or something similar to that, the injections and penile implants. Those are. And so if the other options are regenerative, but the long-term studies are limited, but everybody gets improvement and it's not dangerous, it's not a drug, it doesn't have side effects, then I would say sign me up and I'll just do maintenance to make sure that I'm having good sex over time. And again, I think that is something medicine is always going to be behind. Our studies are 10 years out to support something that we implement. So if you're waiting for long or big studies, you may be waiting a while. And
Absolutely. So like Dr. Durst said, a lot of these studies are smaller, but there are studies on shockwave therapy in men who the little blue pill doesn't work. And even in that study was a 5-year outcome. Let me scroll down so I can give you the stats on it. It was, so this is for men that the shockwave therapy worked where they were not responsive to the Viagra, the Cialis. The efficacy was 60% of patients had improvement with shockwave therapy. So 60% improved when the little blue pill didn't work. And then that was maintained in most patients 12 months post follow-up. And then at 12 months and beyond, 91% of those that had maintained were still happy with their results.
Yeah.
And nobody had any treatment related adverse effects. So we're talking about no negative side effects from treatment. That's huge.
And that's
right?
been
You take these pills and you get side effects.
Well, and that's been across the board too. And when we say 70% of men go untreated, some of that is also men that have had treatment but have side effects, because a lot of men have side effects with PD5 inhibitors. Headaches, nasal congestion. There's lots of, and you can do lower doses, and
They may not be as effective.
They may not be as effective. And so there's lots of things that go into that. And again, when we're communicating with the tissue and telling it's injured, we're talking about endothelial or vascular growth factors. We're talking about nerve growth factors. And so there's lots of little things that are improved, including the nerves. But
Absolutely.
and so orgasmic strength, potentially that sensitivity and premature ejaculation. Those are things that can potentially, be improved upon. Because ED is a very broad term, and that we've talked about before. Again, all the studies are positive. They all have positive results and no adverse effects. It's the length and efficacy, and the ones that do show efficacy, it does show it further out. And
it does. It seems like the studies that we looked at, even as recent as 20 and 23, are looking at, for the most part, a 6-month duration. Some are looking at 2 years, some are looking at 5 years, but we're seeing a continued in these longer studies of 40 to 60% satisfaction rate, continuous more of long-term, right? And so long-term being within 5 years.
And that's still based on those initial treatments too. And so again, if you're adding maintenance in, you can just push that out in my thought, or at least that's,
clinic.
Yeah, true. And again, I think that if you're waiting for studies, you'll be waiting for a while. I think these are good studies that support it. And I think the big thing is we don't want it to be dangerous. We don't want anything to be. And if we haven't looked at studies with the amount of people that are having side effects related to medications we give, or how happy they are with sustained results with injections or penile implants, then we definitely don't need to be overly critical of studies and efficacy for I shouldn't say Gainswave, for Shockwave Therapy and ED, and all the positive things that come from those studies.
Anytime we can regenerate, minimize negative experiences or side effects, and have a positive result, we're all about it.
You can give me regeneration any day. Yes. So the final study that we wanted to bring up, and again, this was I think it was a urology publication talking about ED and offices doing it. It was 8 popular cities that they looked at. They actually made phone calls to offices in there. Examples of some cities: LA, New York, Boston, Atlanta, DC, Houston, Dallas. They called 152 clinics. Again, this is a very interesting study, and we have some different takeaways than I've heard. So 25 couldn't be reached, so they dropped those out of the study. So again, 152 clinics, 25% couldn't be, and again, they'll throw them up on the corner with a sound wave machine of some sort. So that's why you got to find a reputable provider. Only 18%. This is huge.
This is crazy to me.
Only 18% did you have to find. Do you have to see a provider before you started treatment? And so again, what does that say?
Only 18%. You had to talk to somebody before you were treated.
Yeah, so 152 clinics, 18% of those clinics, only 18% did you have to see a provider beforehand. So that means there's a lot of just one size fits all over the phone. You can get an answer. The cost range was huge, but from 600 to 16,000. But again, the largest was New York City. So this is where I think it's interesting. So 25% of those clinics were urologists. 13 weren't board certified. So basically they didn't have a chiropractor office. Yeah, like something that did not have a board certified physician anywhere, affiliated with those exact treatments. And the most common one was GYN. So that again is a GYN female doctor, but again, that's because there's chiropractors putting it up. There's clinics that will, they'll open a clinic, but they're only really doing that isolated shockwave treatment, and you have to be comprehensively doing it and trained on protocols and standardizing your treatment. So I just find it a little shocking that only 18% required a provider. I don't think you need to have a urologist. that is providing it. I think that there's only 25% urology doing it, and that's a problem. I
There
think
should be
that
more. That should
there
be
should
the
be more.
that should be the highest
Yeah.
number.
I mean, if you could go to your urologist and get it, or a urologist and get it, great. They should all be offering it. It definitely isn't a med with side effect. It isn't surgery, and you're not injecting, and you're actually dealing with the problem. So, doing some test, asking, inquiring intakes that talk about sex, that would be great. I'm all for that.
That's it.
But I don't think that you should limit yourself to a urologist, just somebody the offices are very qualified in doing it. And again, customization, standardization, trusting who you're going to. And there were some various treatment protocols, but ask them what their, training is on it, or what machines they're using.
And you should never just walk into a building and get a shockwave
Without
therapy
seeing a
treatment without
provider.
seeing somebody.
Yeah.
Because I can't tell you how many patients that have sat in front of me, and there are better options for them.
Yeah.
Sometimes there are better options. You need to be able to speak with someone that's knowledgeable on those options so that you're not doing treatments that are not going to be effective. Because when you're looking at a price range of $600 to $16,000,
It's a big range, yeah.
that's a huge range. It's a lot of money. It's an investment, and we do believe we should invest in ourselves. However, if it's the wrong investment, it's the wrong investment. That goes across the board with anything in life. There may be a better treatment for you out there, or you may need a combination of treatments to get better sustained results.
Yes.
So just walking in and getting treatment to me blows my mind.
Well, and I think that's where the providers investing in their education as well. So if it takes some money to learn a protocol and figure out what machines, and then what protocols you're using, you're more likely to get sustained results. And so again, while we're not completely hung up on the fact that it has to be a Gainswave, if they're reputable, they've been doing it, and now they're just not marketing it as Gainswave. But at least if you see a Gainswave provider, you know that they have invested in the education. And so there is standardization there.
Shockwave therapy, as we were talking about getting ready for the podcast, it talks about shockwave being for healing, for treatment, for pain, for
Orthopedics,
for
musculoskeletal.
bone.
So, yeah.
Depending on the energy, the pulses, all of that matters. So going to somebody knowledgeable, I think, is important to make sure that you're getting the appropriate setting for your condition as well.
So hopefully that all helps. Don't go in and get a treatment until you find out. Because again, if you think Gainswave is the fix all, but you're not on hormones or hormonally optimized, or you think two are going to work, or one, and you're more advanced in your SHIM score, those are issues. So you want to make sure that you are actually getting the results that you're going to pay for, and that you're fully evaluated. So if you guys have an experience you would love to share, because again, you can do a FemiWave, but we're talking about men's health and sexual wellness. And so we would love to get feedback from our men and hear what your experience has been. If you have any questions, drop them in the comments, and share, subscribe, and let us know if there's anything else you want to deep dive into, because we're willing to talk anything sexual wellness. We're here to revitalize your look, your health, and
Your
sex
sex life.
life. Thank you.